Okay, so get this. We've got this case study, right? And it's from the Journal of Veterinary Cardiology. And it's a real doozy. I mean, it's going to make you rethink everything you thought you knew about, like canine neurology.
Yeah, no kidding.
So we're talking about this 11-year-old Wheaten Terrier.
Okay.
It came in with all these classic neurological symptoms.
Right.
Like, the kind that usually has you reaching for the MRI referral pad.
Yes, exactly.
So like right off the bat, this dog's showing ataxia, basically like, lack of coordination, right?
Right.
And then it's got proprioceptive deficits, meaning it's not really sure where its body is in space.
Okay.
And to top it all off, it even had, get this, an absent menace response.
Oh, wow.
Which for our non-vet listeners out there just means it wasn't reacting to like a hand moving quickly toward its eye.
Right.
So, I mean, at first glance, all signs are pointing to like a neurological issue. Right?
Absolutely. Yeah, all the classic signs of... But here's where things get interesting. So during the initial exam, they discovered this dog had an irregular heart rhythm. Like we're talking frequent ventricular premature complexes, those extra heartbeats, even some instances of ventricular tachycardia.
It's not just a neurological case anymore, huh?
Right, exactly.
We got potential heart problems entering the scene. So what happened next? What did the diagnostics show?
So they did an electrocardiography ECG.
Right.
Which maps out the heart's electrical activity.
Okay.
And it confirmed those irregular rhythms, showed some other abnormalities too.
Red flags going up, I bet.
Oh, yeah. So, to get a better look, they decided to do an echocardiogram.
Makes sense.
Uses sound waves, to create a moving picture of the heart.
Right.
And that's where they got a real surprise, a large mass right in the left ventricle.
Oh, wow. So they were thinking brain tumor, but now we've got this heart mass just lurking in the background?
Yeah, exactly.
Talk about a plot twist. Did they think the two were connected at that point?
Well, it definitely threw a wrench in their initial diagnosis.
Yeah.
You see, brain tumors, they're definitely on the list when you see those neurological signs, right? But a heart tumor presenting with neurological symptoms, that's a whole other ballgame.
A real head scratcher for sure.
Yeah.
So did they do any other imaging?
Yep.
Like an MRI to try and pinpoint that potential brain tumor?
They recommended it for sure. An MRI would have given them a much clearer picture of what was happening in the brain. But due to the suspected poor prognosis with the heart mass, the owner opted for humane euthanasia.
Yeah, I can understand that, given the circumstances.
Right.
But thankfully, the silver lining here, the owners agreed to a necropsy.
Yes.
That's where things get really interesting, right?
Absolutely.
What did the post-mortem exam reveal? So this is where the real detective work starts, right?
It really is.
What did they find during the necropsy?
Well, the necropsy confirmed a few things. First, they did find multiple metastases in the brain.
Okay, so that's what explains those neurological symptoms then.
Exactly. It wasn't a primary brain tumor, though.
Okay.
It was the heart tumor that had spread.
Wow. So the heart tumor was actually the root cause of those neurological symptoms all along.
Exactly.
That's crazy. And what about that large mass they found in the left ventricle?
Oh, yeah. The necropsy revealed that it was a hemangiosarcoma.
Hemangiosarcoma. That's a tough one. Isn't that a type of cancer that starts in the blood vessels?
It originates in the cells that line the blood vessels. And in this case, it wasn't just any hemangiosarcoma. This one originated in the interventricular septum.
The wall between the ventricles.
Exactly. Yeah. And it had spread aggressively, not just to the brain, but to both the right and left ventricles, the lungs, and even the liver.
So a very aggressive tumor and a really, really tricky spot. That poor dog. Did they find anything else during the necropsy that stood out to you?
There are a couple of things that make this case really interesting.
That's right. What is it?
First, the fact that this hemangiosarcoma originated in the interventricular septum is incredibly rare. Incredibly rare. We're talking only a handful of documented cases in all the veterinary literature.
Wow. So this wasn't just a case of a dog with a heart tumor. This was a dog with an incredibly rare type of heart tumor.
Exactly. That's huge.
It really is. And it makes you wonder how many other cases like this are out there.
Saying undiagnosed.
Yeah, or misdiagnosed. It really highlights the importance of keeping an open mind, even when we're faced with what seem like textbook cases.
100%. So the second interesting thing...
Oh, right. The second interesting thing is that even though this tumor was incredibly aggressive, it didn't actually spread to the pulmonary arteries, which is unusual for a hemangiosarcoma.
Oh, that is interesting. So even within the rarity, we're seeing unusual patterns. What could explain that?
It's tough to say for sure with just this one case. There could be genetic factors at play, environmental influences, or even just random chance. but it really underscores how much we still don't know about this disease. It's a good reminder that we're always learning in veterinary medicine, always uncovering new layers of complexity. Now let's talk about the elephant in the room, the prognosis. This type of cancer is known to be aggressive, and with the metastases they found, it wasn't good news, was it?
Unfortunately, no, you're right. The prognosis for this type of hemangiosarcoma, especially with the extent of metastasis, is extremely poor. Even with aggressive treatment like surgery, chemotherapy, or radiation, the chances of long-term survival are slim.
It's heartbreaking, but it's the reality of these aggressive cancers. Sometimes, even with the best veterinary care, we're fighting an uphill battle.
It's definitely the most difficult part of our job, but this case, as heartbreaking as it is, does offer some really valuable takeaways for veterinary professionals.
Absolutely. It's about turning these individual cases, these aha moments, into learning experiences that can benefit the entire veterinary community. What are some of the key things you think vets should take away from this case?
Well, first and foremost, it reinforces the importance of thorough diagnostics. If they hadn't done that echocardiogram, they might never have found the heart tumor until it was too late.
It's like that old saying, if you don't look, you won't find.
Exactly. Secondly, this case really drives home the importance of considering all possibilities, even the rare ones. Just because a dog comes in with neurological signs doesn't mean the problem is in the brain.
It's about thinking outside the box, right? Looking beyond the obvious and considering all the angles.
Exactly. And finally, this case highlights the importance of communication. Open and honest communication with pet owners, even when delivering difficult news, is crucial.
Absolutely. Being able to explain complex medical conditions in a way that pet owners can understand and being compassionate throughout the process is what builds trust and allows us to provide the best possible care. Now, I want to go back to the echocardiogram for a moment. You mentioned it was key in identifying the heart tumor. Can you walk us through some of the specific findings on that echo and what made them suspicious?
Of course. So remember, the echocardiogram uses sound waves to create those images of the heart in motion. And in this case, the echoes showed this large, distinctly shaped mass in the left ventricle. What really stood out was its echogenicity.
Echogenicity. For those of us who haven't spent much time staring at echocardiograms, what does that even mean?
Basically, it refers to how bright or dark something appears on the ultrasound image.
Right.
In this case, the mass was hyperechoic, meaning it appeared brighter than the surrounding heart tissue. This brighter appearance, coupled with its irregular shape and the fact that it was infiltrating the interventricular septum, raised some serious red flags for a tumor.
So the echocardiogram provided crucial information, not just about the presence of the mass, but also its potential malignancy, all thanks to how it reflected sound waves. That's incredible.
It really is. And it highlights why echocardiography is such a valuable tool for us. It allows us to visualize the heart in real time, assess its function, and identify abnormalities that we might not be able to find on a physical exam alone.
Speaking of other diagnostic tools, I know they also recommended a thoracic radiograph. Why was that necessary, considering they were already focused on the heart?
Good question. Hemangiosarcoma is notorious for spreading to other parts of the body, and the lungs are a prime target. The thoracic radiographs, or chest x-rays as they're more commonly known, were recommended to look for any signs of spread to the lungs.
Makes sense. It's about getting as much information as possible, even if the initial focus is on a specific organ.
Precisely. And they also recommended an abdominal ultrasound.
To check for more metastasis.
You got it. Hemangiosarcoma has a knack for spreading to other organs, particularly the liver and spleen. The abdominal ultrasound lets us look inside the abdomen and assess the size, shape, and echogenicity of these organs, looking for any signs of metastasis.
It's like putting a puzzle together. Each diagnostic test gives you a piece of the puzzle, and by putting all those pieces together, we get a clearer picture of what's going on.
That's a great analogy. And in this case, even though the necropsy ultimately showed us the extent of the metastasis, these additional imaging tests would have provided a more complete understanding of the disease process.
Which brings us back to the importance of thorough diagnostics, even when we're dealing with a difficult prognosis.
Absolutely. Every piece of information, every test result adds to our understanding and helps us make the most informed decisions for our patients.
Now, I want to dive a little deeper into the necropsy findings. You mentioned that the tumor had a very specific appearance. Can you walk us through what the pathologists found?
Sure. During the necropsy, they carefully examined the heart, and they found this large mass measuring about 1 centimeter wide and 3 centimeters long, originating from the interventricular septum, just as the echocardiogram had suggested. The mass was poorly demarcated, meaning it didn't have clear boundaries within the heart muscle, and it had a rather ominous appearance, dark red to brown, somewhat gelatinous and multinodular.
Not a pretty picture.
No, not at all.
And what about the area surrounding the tumor? Did they find any damage there?
They did. The area of the left ventricle right next to the mass showed clear signs of myocardial necrosis and inflammation. What that means is that the tumor wasn't just growing in the heart muscle, it was actively damaging and inflaming the surrounding tissue, which would make it even harder for the heart to function properly.
It's amazing how resilient animals can be. Often they don't show any outward signs until a disease is very advanced.
It's truly remarkable. Now moving on to the brain. Remember those multiple metastases we talked about earlier?
Yeah.
The necropsy revealed about a dozen distinct, well-defined lesions scattered across the surface of the cerebral cortex. They were dark red and circular, classic signs of metastatic hemangiosarcoma.
And those lesions would have been responsible for those neurological symptoms the dog was showing.
Exactly. Those tumor cells had traveled from the heart through the bloodstream and ended up in the brain where they continued to grow and cause damage.
It's scary how cancer can affect seemingly unrelated parts of the body. Did they find anything else in the brain during the necropsy?
Yes, they also found areas of hemorrhage throughout the brain tissue.
Hemorrhages in the brain. That sounds serious.
It can be. Brain bleeds can cause a wide range of problems depending on their size and location. In this case, the hemorrhages were likely caused by the tumor disrupting the normal blood flow in the brain.
So not only did this poor dog have to deal with the tumor itself, but also with bleeding caused by the tumor. Just a cascade of unfortunate events.
It really highlights how interconnected all the systems of the body are and how one problem can create a domino effect leading to multiple issues.
And speaking of which, you mentioned that metastases were also found in other organs.
Unfortunately, yes. The necropsy revealed multiple well-defined nodules in all the lung lobes, confirming those pulmonary metastases we talked about. And they also found similar masses throughout the liver.
So this disease originated in the heart and then spread to multiple other organ systems. It's a lot to take in.
It is. It's definitely a stark reminder of the challenges we face in veterinary medicine, but it also reminds us of the incredible resilience of animals and how important our role is in alleviating their suffering.
It really makes you realize that every case, even the really sad ones, has something to teach us.
Absolutely. And this case, with how unusual it presented and how rare the diagnosis was, really highlights how important it is to always be curious.
Right.
To never get complacent when we're approaching veterinary medicine.
Yeah.
There's always more to learn.
Oh, wait.
Always new connections to be made.
It's what makes it so challenging.
Yeah.
But so rewarding, too.
Absolutely. In this case, with both the cardiology and the neurology aspects, it reminds us that veterinary medicine is rarely just about, neat little categories. We have to be willing to consider everything, think outside the box to really take the best care of our patients.
Absolutely.
Yeah.
We've talked a lot about what we can learn from this case clinically.
Right.
But I want to take a moment to talk about the emotional impact.
Yeah.
Because these kinds of cases where the prognosis is really bleak, they can really take a toll.
Mm-hmm.
So what advice would you give to other vets out there who might be struggling with similar cases in their own practice?
That's such an important point, and it's something we don't talk about enough. These cases, they can be so tough. Emotionally, mentally, it's draining. My advice is don't be afraid to reach out to your colleagues, mentors, your support network,
Yeah.
Talk about it. Process those emotions. And remember, you're not alone in this number. Veterinary medicine is a team effort, and that includes supporting each other through the tough times.
I love that we're all in this together and sharing those experiences, both the good and the bad. It makes such a difference.
It really does.
Well, I think we've covered a lot of ground today. Any final words of wisdom for our listeners before we wrap up this deep dive?
Just this. Keep that spark of curiosity alive. Never stop asking questions. Never stop exploring new possibilities, and keep pushing the boundaries of what we know about veterinary medicine. That dedication to knowledge and compassionate care, that's what moves our profession forward.
Beautifully said. Until next time, from Vet Neuro Jar, keep those minds inspired, hearts light, and tails wagging.